Okay, so part two. Here is what to look for when you're trying to find someone who can do a quality assessment for dyslexia, ADHD, or autism for either yourself or your child. Number one, do they have the credentials and the experience? Have they done this before? Do they have a website where you can read more? Have they really invested in their own business to be able to support you? Because I've seen that the folks who have done that work are typically also using the tools and the measures that reflect that investment in their own business, and then likewise their investment in you as their client or their patient. Okay, number two, are they aware of autistic and ADHD presentations in girls or individuals assigned female at birth? Some people just have not done the continuing education or made themselves aware of non-stereotypical presentations of ADHD or autism, and are a little bit stuck in stereotypical presentations, meaning like, oh, this is what it looks like when, my grad school professor went to school 40 years ago, instead of like, this is emerging research and this is what it looks like in the past decade, in the past 15 years. This is how it presents differently in individuals who are girls or women or non-binary, not just the traditional tracks. That is so important, because I feel like there's nothing more devastating than to invest your time and your money and your energy in an assessment and leave dissatisfied because the person got it wrong. Okay, so are they experienced, knowledgeable, and qualified? Also, when you're going through the process itself, is there a records review involved? So is the person asking you for the records of past testing, including school testing, report cards, and reading teacher comments on each of those report cards? Are they asking you for records of just anything that is relevant to the actual assessment? So that actually goes hand in hand with, are they getting collateral data, collateral information? So not just taking your word for it, although we believe you, but also are they asking for family members, partners, spouses to also provide information about you or about your child? Are they getting forms completed by teachers if it's a child? So getting multiple perspectives that all contribute to that assessment, because ethically, that's what we should do as clinicians, is take the word of the person who is coming to get the assessment, but then also get that collateral information, particularly for ADHD and autism diagnoses, because right now in our diagnostic manual, both require that features of ADHD and autism are present in the early developmental period, present in childhood. So not just what the person says, like, oh yeah, when I was in fifth grade, this happened, but also like, okay, is that documented on report cards by teachers? Do the parents or, older family members, can they also back up that? And filling out standardized rating forms or symptom inventories, research backed, that also support that information that you're providing about yourself or for your child or the teachers are providing. Now, that doesn't mean that the teacher is going to agree and endorse all these different features or symptoms. It doesn't mean that the parents are going to agree, especially if they have their own undiagnosed neurodivergence or they're in denial. but the clinician should still be trying to get that information. And an assessment means it's not just giving you a test, but it's also collecting information from multiple different data points and data sources to be able to provide a full picture of what is and what is not going on for you. Also, is there a component of differential diagnosis? What that means is, are they not just looking at, do you have ADHD or do you have autism, but are they also saying like, okay, is it ADHD or stress or symptoms of severe depression or anxiety? Is it autism or social anxiety or social pragmatic communication disorder? Is it PTSD and trauma? Is it a combination of all of these different things? And so that's going to require a structured clinical interview where they're asking you about the presence of other things that might be going on for you. So symptoms of mood disorders and family history and stressors that you have going on, all of those things, to be able to see, is there something more than just ADHD autism going on, or is it better explained by something else that is not ADHD and autism? Keep in mind that 70% of individuals with ADHD or autism have at least one mood disorder. So it's usually both and not either or. Let's see. I'm sure there are more things, but that's just to get you started. I hope this is helpful. And if you do have questions about the assessment process, then, pop something in the comments, send me a message. You can email me at drblyde@drblyde.com. And I definitely welcome whatever questions that you have. Let me see if I can change the view here. I welcome it, and thank you for watching. Thank you for listening to my TED Talk, this super long video. And of course, if you would like information on my assessment services, I help individuals ages 5 and up. So 5 to about 45, like middle age, as long as there are not new memory concerns. If there are new memory concerns in middle age, then I typically will refer out to a neuropsychologist who specializes in assessing dementia. But anyway, I guess that's it. Bye for now.